Thank you for joining us today. I'm Jessica. I'm the coordinator of Healthy Lamoille Valley. We are a substance prevention coalition serving Lamoille County and the greater Hardwick area in northern Vermont. And we are also a program of the Lamoille Family Center and a member of the Northeast Vermont Prevention Consortium. Thank you for joining us today for this Lunch and Learn on the Youth Substance Prevention Toolkit. We do have hard copies available. You can email me at jessica@healthylamoillevalley.org to get a copy of that, or stop by the Lamoille Family Center and ask at the front office. Today's presenter is Julia Pensick. She is a UVM Masters of Public Health student. She is also our interim prevention support specialist, while Allison is out of the country on sabbatical for a few months. So we're really happy to have Julia with us. She interned with us as an undergrad, and it was really exciting to be able to get her back for these months. A little history on the toolkit. The first toolkit actually came out 10 years ago in 2014, and it was primarily for community planners. And the vision was that prevention work is really important, and how do we provide somebody with a tool that they can use in their work? And what we found from that toolkit was that we were often going to certain pages because a lot of it was very text heavy. And then the idea was, why don't we create a workbook out of this? And so the second version was a workbook toolkit style, much more user-friendly. And then this last summer, we came up with version 3 or so, third edition. And this has more practical for more audiences. So it's not just community planners and those working on town level policy. So Julia is going to highlight those changes and also talk about how to use the toolkit. So thank you for joining us today. Also, thank you to Green Mountain Public Access TV. They're recording this, so it'll be available after this time frame. And please feel free to raise your hand if you have questions, or you can put them in the chat, although it might take us a moment to see them in the chat. So Julia, I'll turn it over to you and I'll start sharing the screen.
Thank you so much, everyone, for taking the time, and thank you, Jess, for introducing me. Really appreciate it. I know everyone's super busy this time of year and everything. So yeah, we'll jump right in so we can go to the next slide. So to start off, just, a general table of contents if you find yourself referring to this presentation, which would be awesome. Just kind of see where everything is. So we're going to start off with an introduction of the toolkit and new updates in this third edition, and break out each group and community members' role in preventing youth substance use, finishing the presentation with additional resources and action steps, and we'll do a Q&A at the end as well. So who we are. So Jess already, gave a great spiel of Healthy Lamoille Valley. So just, speaking generally, Healthy Lamoille Valley is a coalition of individuals and community organizations working collaboratively to prevent and reduce youth substance misuse and encourage youth to make substance-free, healthy choices. So in order to prevent youth substance misuse, it takes every individual in our community's awareness and understanding of the dangers of early engagement with substances. Generally, youth model behavior that is presented to them and represented in their community. If as individuals, parents, teachers, community leaders, members, we normalize substance use and model such behaviors in front of and around youth, we are not encouraging substance-free healthy choices or modeling what life looks like without using substances. Community prevention acknowledges and notices what our community teaches youth about substances. Each of us can make a difference in our community toward reducing youth substance misuse, whether through actions in our personal lives or changing community norms and policies. So about the toolkit. So who, what, when, where, why, and then there's also a how that we'll get to. So who? So as Jess said, this new version of the toolkit is really designed for everyone. The health literacy can be engaged with youth and adults, anyone that wants to take steps to reduce and prevent youth substance misuse and get better educated on the resources in our communities. It's really for everyone. Anyone can open it. And then what? So the toolkit is a community planning guide focusing on reducing youth misuse of alcohol, tobacco, cannabis, and prescription drugs while supporting efforts to help youth make healthy substance-free choices. There are many factors that lead to substance misuse, and many factors that lead to prevention of substance misuse, including individuals, family, organizations, businesses, and systems level policies that impact substance prevention. The toolkit highlights stakeholders from across the community, demonstrating the role we each have to play. And additionally, the toolkit aims to inform viewers of risk factors, inequities in substance misuse, the role of community prevention, and much more. And then the when. So our hope is that youth, parents, educators, businesses, organizations, and municipal leaders will all use this toolkit in different settings to build protective factors and reduce risk factors in our community. This can be used as part of a town or organizational planning process or as a standalone resource to support healthy community and policy development and strategies. And as always, Healthy Lamoille Valley is available to facilitate group discussions and help create substance prevention plans with your community. And then the where, so as everyone can see, the 15 towns supported by Healthy Lamoille Valley and the Lamoille Family Center. We love them all and they're all so important. And then the why. So why are we doing this? Why does this matter? All that good stuff. So the brains of young people are still developing until they're 25. This puts them most at risk for substance misuse, especially if they start using at an early age, therefore increasing their likelihood of becoming dependent on substances and experiencing negative health outcomes. Our job and responsibility is to reduce the risks in our community that lead to substance misuse and to increase factors that protect our youth. All right, so now the very exciting things. So what's new? So if we think about it, from the last toolkit to now, as a world, we've experienced a lot of things. And, number one thing that probably comes to everyone's mind, COVID, that had a huge impact on everyone, and everyone has their own story. And so we have the main paragraph from the toolkit on the slide, and feel free to read that. But here are the main local and national challenges. First, as we all know, retail cannabis is now legal in Vermont. I believe that at the time of the last toolkit, that was not the case. And this has a direct impact on our youth. Ease of access, visibility of advertising and consumption, and social norming of cannabis have now entered the lives of Vermont youth. Second, the COVID-19 pandemic has had a direct impact on all of our lives. The pandemic had and continues to have a prolific impact on the lives of youth. We're seeing these impacts nationally and here in Vermont. Mental health issues have increased due to social isolation and several other factors, as well as increased substance misuse and overdose rates across Vermont. Additionally, with all of that, the pandemic, since students were not in school, and all of that has really impacted substance use trends in data. So when we look at data from the 2021 YRBS, Brephis, all of those, they have to be interpreted with caution. For example, this year's YRBS was done in the fall instead of the usual springtime, meaning that students were overall younger when they completed the survey. In addition, students who participated in the 2021 YRBS may have had a different educational and social experience compared to previous participants. So, things like ease of access during that year and all of that, we've seen trends go down, but it doesn't necessarily mean that it's true. It's just that students were at home, they weren't socializing. So we have to be cautious about the data and not allow it to lead us to believe that we're having better outcomes than might be true. So yeah, those are some of the main new things, as well as we are really highlighting equity in this toolkit and how important equity is in substance prevention. So we can go to the next slide. Okay, so utilizing our toolkit. So I think some people don't realize when they get the toolkit how great of a resource it is. I mean, it's compiled with really great data and just really great tools for community planning and all sorts of things. So first, in the images, you can see this was a group action planning with allied health students that I think was just a couple months ago. And we had the toolkits there for them. They were writing in them. So that just shows, youth can use it, adults can use it, anyone in between. One of the new features of the toolkit is that there are active prompts and activities that can be checked off or answered, and there's little yellow sticky notes that you can brainstorm things as you go through the workbook, applying to all community members, and we'll go into more detail of that later in the presentation. That's really it. So the toolkit is designed to help support those working to create healthy communities and to take some of the guesswork out of the process. There is a focus on systems, policies, organizations, businesses, relationships, and family interventions, which is a new addition that we'll get into later. And then just a great example to show that this toolkit really can be used to create success. Erin from Hyde Park Elementary used the toolkit in a successful grant application, which is so awesome, and we love to hear stuff like that. So now we can talk about equity. So substance misuse historically is often an equity and justice issue, and it's crucial that we consider equity when creating policies and actions that support prevention. So I'm going to read the quote because I really, really like it from the Vermont Department of Health. And you can read along with me. That's in the bottom under the bar graph. So health equity exists when all people have a fair and just opportunity to be healthy, especially those who have experienced socioeconomic disadvantage, historical injustice, and other avoidable systematic inequalities that are often associated with social categories of race, gender, ethnicity, social position, sexual orientation, and disability. So, just to give an example, thinking about how, because this could be a confusing topic for some people to really understand. So, thinking about how the tobacco industry targets youth with flavored electronic vape products. So, youth are vulnerable for a lot of reasons, and putting a product out there like that, it's very targeted. It's not just full, etc. And there's lots of examples. Um, so I'm going to read a few points from the green picture in there. So substance industry tactics often target more vulnerable populations, such as youth, different ethnicities and races, places that are more have like food deserts and things like that, more ACEs. Individuals and communities with fewer resources are likely to endure more stress and less access to medical and mental health services. The pressures that exist in an environment affect substance use. Um, and so just thinking about, when people don't have resources to take care of themselves, it's really easy to turn to substances, and having empathy for that and recognizing that it's not always someone's choice to engage in those behaviors when they don't have what they need. And also important to know, and if you go to page 8 of the toolkit, there's a lot more information on each of these bullet points, but substance misuse impacts our community education-wise, physical and mental health, public safety, economically, and employment. And I think I have a few points about each of those, maybe not. So out of this slide, in prevention, we must adjust our language, actions, and policies to support vulnerable populations that are targeted by the substance industry and promote equality. And next we have the Vermont Prevention Model, which I'm sure everyone on this call is very familiar with. But this is the Vermont Prevention Model that often guides prevention work throughout the state. And I put this in here because it's very important with all the work we do and all the work of our community members and leaders. But it's important to recognize that prevention can be seen at many levels, and it's important to recognize the gravity of everything sitting on top of the individual. And so we all play a role in that. So it starts at the individual and it only goes up. So there's a lot sitting on the individual. So I wanted to just read a few examples of things that Healthy Lamoille Valley have done for each category to have a better understanding. So, individual knowledge, attitudes, beliefs. So health education, media literacy, educational campaigns, educating everyone. And then relationships, student assistance, mentoring parents and grandparents, educating parents about the risks of substance use, spreading that knowledge, creating youth coalitions that are comfortable where people can share, why they're choosing to not engage in substances at a young age, etc. And then organizations. So tobacco cessation, worksite wellness, 3450, which we'll get into, and um, HLV did refusal skills and time-wise curriculum at area schools, great things like that. What can we do in schools and work sites and faith communities, etc. And then community, so substance-free community events, signage, all that great stuff to show, our community supports substance-free lifestyles and healthy choices. And then on the policy and systems level, which I think a lot of us find ourselves the most distance from, unless you're directly in that work, which can be frustrating as a civilian. But, local, state, federal policies, the economic and cultural influences of media. So substance-free parks, having a policy for that, community I can't say that word, so I'm not even gonna try. Municipal planning, all of that good stuff. So yeah, really important to always refer back to when we're creating programs, talking about things. So really great. So where youth see substances in our community. So, as adults, it's really easy to overlook the constant advertisement of substances as we've become so normalized to it. I mean, I don't even notice the ads anymore because they're just everywhere. But we have to remember that, youth and children notice details and it's everywhere. So, for example, grocery stores, gas stations, convenience stores, ski resorts, community races such as 5Ks, community events, parks and recreational spaces where there might be trash and people engaging in substance use. Recently, I've noticed a lot of popular clothing stores for younger people doing a lot of branding of Bud Light apparel, Budweiser apparel, Coors Light, all of that. And then family events as well, where alcohol is just out and available and no one's really regulating. And then additionally, as we've heard from our youth, the pressures of social media have been really impactful as to where youth are seeing substances. It's a new element, it's not something that we can regulate super well, but it puts a lot of peer pressure on other youth, portraying substances as being really cool and fun and, sharing videos with each other. And on the slides, you'll see direct screenshots from the toolkit of we spoke to area youth, here's what they've noticed. So there's some really great examples that came directly from our youth, very similar to the list that I wrote out about ski resorts and, the marketing of flavored vapes and all of that stuff. And then just some good photos of real examples. So now we're going to start breaking down the roles that we can all play in our communities by each level. This is the newer part of the toolkit, which is really great because it, directs actions to people that hold certain titles or certain roles in the community. And a lot of people find themselves in multiple of these. Maybe they are on the select board, but they're also a parent and maybe they're a coach too and involved in the school. So it's really great, very interchangeable. And this is all in the toolkit. So I'm not going to read everything. These are just snippets of it. So, for example, on a policies and systems level, so information for municipal leaders, boards, commissions, policymakers, and legislators. So just a few risk factors to consider decreasing: marketing or distribution of substances in areas where youth are present, high density of substance-related businesses, and presence of substances in spaces such as parks, trails, and playgrounds when youth are present. Consider increasing these protective factors, so systems, policies, laws, and community norms that encourage non-use and prioritize healthy individuals, families, and communities. Policies limiting youth access and availability of substances, equal access to resources such as housing, healthcare, childcare, transportation, employment, recreation, etc. And on the slide, you can see a great example from Elmore of their sign for a substance-free, I don't know if that was a park, Jess, or what that was. Parks and trails, yeah. So that's wonderful. Any community can have that if they want. And then on the bottom left, you'll see part of the toolkit, the actions you can take. So each page has this for each role in the community, and these are really great. So just to help brainstorm, and you can check these off as you go. So just as an example, engage your town in a strategic planning process related to substance misuse, prevention, treatment, and recovery, or include a health and wellness chapter in your town plan. So there's so many things. Some are really small, some are bigger, some would take a lot of time, but just all good things to get the brain thinking. So the next slide is that level of organizations and community partners. So information for schools, work sites, youth sports and organizations, faith groups, and social services. So once again, just going to read a few. Obviously, they're on the slide there. So consider decreasing these risk factors. Community attitudes are unclear about or encourage substance use. Low adult and parental perception of harm from underage substance use. Um, High unemployment levels, all those things, and then consider increasing these protective factors. So a safe, supportive, and encouraging community, community service, and other extracurricular opportunities for youth so that there's not too much unstructured free time, because we know that can lead to some poor decision making, and then exposure to evidence-based programs and strategies for prevention. So once again, there's so much more in the toolkit. So that's great. And then the next slide, continuing on with organizations and community partners. So once again, a snippet from the actions you can take. So just going to read a few. Collaborate with retailers to decrease substance promotions such as outdoor advertising and signage for alcohol, tobacco, vape, and cannabis products. Engage other community members in community planning processes. And then I want to highlight one of the action steps, become a 3-4-50 partner with the Vermont Department of Health and work towards reducing chronic disease through reducing tobacco use and increasing healthy nutrition and physical activity. Um, so 3-4-50 helps us understand the overwhelming impact of chronic disease in Vermont and inspires us to take action to change it. 3-4-50 is about making a difference at a level that can influence the health of many businesses, schools, cities, towns, healthcare providers, all play an important role in shaping the health of Vermonters. So if you're interested in becoming a 3-4-50 partner, it's super easy application and just really great to do if you have a business or organization. All right. And then the next group, substance industry retailers and licensees. So information for retailers selling alcohol, cannabis, tobacco, nicotine products, and paraphernalia. So consider decreasing some of these risk factors. And also in the bottom left, you'll see an awesome sticker that was created by Healthy Lamoille Valley in a cooler campaign with thinking about having 2 coolers at a barbecue or having this on a what is it called? Cooler door at a retailer. You know, these are 21 plus beverages. These are for all. It's a really good way to just separate and be able to keep an eye. So consider decreasing these risk factors. So lack of consistent carding, which we often hear from youth in the community, that is a problem, that carding is not consistent. Untrained or unevenly trained staff, product placement near youth-friendly items or at youth sightlines. So for example, you know, you have toys and candy here, and then right across is the beer and wine. That would be an example of that. And then consider increasing these protective factors. So carding commitments and incentives for staff that pass compliance checks, a well-monitored store, product placement that keeps substances separate from other products that puts them out of youth sites. And then there's so many more in the toolkit, but we'll just read a few. And we can go to the next, which will probably be the actions. Yep. So I'm going to read a little spiel from the National Institute of Health. So according to the NIH, easy access, normalizing of use, inconsistent messaging, low perception of harm, and inconsistent enforcement of policies leads to youth use. The more risk factors there are, the greater the likelihood that youth will use. If we can reduce these risk factors, we can delay underage use of substances. Adults aged 26 and older who began drinking before the age of 15 are 3.5 times more likely to report alcohol use disorder in the past year than those who waited until age 21 or later to begin drinking. So I also included some images of products that debatably are marketed at youth just by the colors, the flavors, the the bottom left corner is THC products that look like Doritos and Jolly Ranchers. Just not really, they don't really look too much like something that an adult might go for right away. So I wanted to include that. And some of the actions that this party can take, have a clear loss prevention plan if adult use substances go missing, have staff complete required trainings, know and follow all state regulations, and so much more in the toolkit. There's just a lot of really great ways to prevent these types of things. So relationships. So I think a lot of us fall into this one, probably most people. So information for families, peers, social networks, youth coaches, and associations. So we often hear from youth in our community about the ease of access to substances because parents, family members, and caregivers directly provide substances to youth. In youth's lives, relationships are everything. So consider decreasing these risk factors. Unclear expectations around substance use, communication, and house rules, easy access to substances in homes and at parties, casual or permissive attitudes towards substance use by adults around children and youth, and then modeling substance use in front of children and youth. And then consider increasing these protective factors. Um, youth engagement in and out of school time programs and other positive and meaningful activities help youth learn how to use their free time in healthy ways. Frequent conversations about the risk of substance misuse, clear expectations from parents, and youth feeling valued and like they matter to others. So actions that can be taken by everyone that falls into the relationships category. Um, show youth they matter, help build a sense of belonging and attachment for youth, help support youth mental health, encourage and create spaces for youth voices to be heard, secure and monitor all adult use substances and medicines in the home, and so many more action steps in the toolkit. And I did put some pictures in of just one of them is a prescription medication lockbox, and then the other one is more for like younger kids, because I think a teenager could probably figure out how to open that. But yeah, considering getting a lockbox for any paraphernalia and for prescription medication, locking alcohol, all of that good stuff, just then it's not even a problem, it's locked. So resources and next steps. So consider becoming a 3450 partner, consider substance-free signage, consider substance-free community event planning, consider equity in policies and programs, updating town plans with equity language, stickers for businesses and families that we can provide. And once again, we're here to support with resources to create a healthy community. And on this slide, once again, the Hyde Park Healthy Community sign, which we love to see. We're here, we have resources, reach out. So thank you. So now we have time for questions and answers. If anyone has questions, also this QR code should take you to the toolkit online. If not, there's a link. Yeah, thanks everyone.
Thank you so much, Julia. That was a good comprehensive overview. I did wonder, Julia, if you could explain the term food deserts a little bit more, and how that might impact marketing to those in food deserts.
Mhm. So a food desert is basically there's scientific like terms for the mileage and stuff, but it's basically an area where fresh foods like vegetables, fruits, all of that are not available. And so in place of that, usually there's a lot of fast food establishments, convenience stores, um, and places where just unhealthy food and alcohol and tobacco are available, basically. So not having the ability to purchase vegetables and fruits and things to make meals, just puts someone back in their health and then can fill that void with other things.
There's also, I don't know all the details, but there's several bills in the House and Senate. So if you have concerns, you can reach out to your local legislator. Vermont's very accessible to reach our legislators, let them know what things you're concerned about. And we actually do have a legislative bill tracker. I haven't read it in full detail for this week, so I don't know all of the exact details of where things are at. But if that's something that you'd like to be added to receive those, please let me know and we can get that out to you as well. So awesome. And I guess thank you so much. If you need to reach us, my email is jessica@lamoillefamilycenter.org, and I can get emails over to Julia or any other members of our team. Our email is healthylamoillevalley.org. And the toolkit is on the website and can be downloaded. So thank you all and have a wonderful afternoon.
Yes, thank you all.